Welcome back to Taking Charge of My Cancer podcast. And in today's episode, we explore a powerful intersection between science and personal experience. Our guest is not only a breast cancer survivor, but also a microbiologist who work focuses on understanding the microscope world of bacteria and how it impacts human health. In this conversation, we talk about her experience with diagnosis and treatment, how her scientific background shaped the way that she processed her cancer journey, and how living through the disease changed her perspective on research, medicine, and the human side of science. So, Debra Brunson is a 37-year-old breast cancer survivor. She was diagnosed almost a year ago, and she can see the light at the end of this year worth of treatments. But being a survivor is not all that she is. She's married with no kids, but she has four elderly pugs. She lives to joke with her husband that they run a nursing home for dogs right now. They live in Jacksonville, Florida, and like to spend most of their time cuddled up on the couch with the dogs, watching movies or TV or reading. She has a PhD in microbiology and immunology and current work as a postdoctoral associate at the University of Florida, where she studies bacterial pathogens. Having a bit of knowledge on biomedical science has really helped her to understand and cope with her diagnosis and treatment. While all cancer journeys are unique, she thinks her diagnosis and journey will sound familiar to a lot of women. And those who are newly diagnosed and are scared and unsure or what's lie ahead, she hopes her story will be helpful and comforting. Science and medicine have come such a long way that even though it's still a hard and uncomfortable journey, it's now possible that we can only survive our diagnosis, but we can thrive in this time too. So I'm so excited for this conversation, Deborah. Thank you so much
Yeah,
for being here.
thank you for having me.
Absolutely. So, you want to introduce yourself and tell us a little bit about your work as a microbiologist?
Okay, so I'm Deborah. Nice to meet you. I work at UF College of Dentistry, and so you may think that maybe I work on dental sciences, but I'm actually kind of an oddball in my lab, and I work on a bacteria called Enterococcus faecalis. This is a bacteria that's known for causing a lot of different types of infections, including like wound infections and UTIs, and even infective endocarditis, which is like a heart infection. And so it's a pretty serious pathogen. And I am studying how important different metal uptake systems are to its ability to cause disease. And so that's really where I'm at right now in this journey.
So, when you were diagnosed with breast cancer, what was that experience like for you?
Yeah, so I think like a lot of women my age, I wasn't going in for like a routine screening and found breast cancer. I went in because I found a lump and I didn't have a GP originally, because I feel pretty healthy other than the cancer. And so I didn't have a normal doctor to go to. And that was kind of the longest thing, was just trying to find anybody who could see me in a timely manner. Most places that I called around and asked to said it would be at least 6 months before they could see a new patient. And luckily, I was able to get in to St. Vincent's, and they had an opening, but it was still a month out. So after I found the lump, it was still a month before I was able to go and see a GP. And in that time, it went from a lump that I could feel, and it was probably about the size of a gumball or a quarter. And by the time I got to the doctor, it was quite large. And um, but because of my age, she really didn't think that it was going to be cancer. She was like, it's probably a cyst, but I have a family history of breast cancer, and my grandmother on my mom's side was diagnosed in her early 40s. So she said, with that, let's go ahead and we'll be safe, and we'll get you over and get a mammogram. And this is a little shout out to boutique breast imaging in Jacksonville, Florida. And if anybody out there needs to see a provider in the Jacksonville area, I highly recommend the way that it's Dr. Catherine Pearson who runs this, and the way she has it set up. She can do the mammogram, the ultrasound, and the biopsy all in one day.
Oh, wow.
And from what I've heard, that's pretty unheard of. Most people have had to do the mammogram and then they do
Yeah,
the ultrasound and then they do the biopsy, and there can be weeks in between.
right. That's
Um,
amazing. I wish
yeah, so I
here.
did it all in one day. So the day that I went for my mammogram is also the day I found out that I probably had breast cancer. She said off of the imaging that it looked like it was definitely in the lymph nodes, and it looked a lot like cancer to her. She sent the pathology off to UF, and within like 2 days, it was confirmed that it was cancer. It was a HER2 positive breast cancer at stage 3B. And I got very lucky in that she was able to get me into an oncologist within about 2 days after getting the pathology back. So things got rolling much, much quicker than that. So the diagnosis, um, was pretty crazy. It was not really expected, of course. But
Absolutely.
I feel like I got lucky in a lot of ways in not having, I had to wait for some time to get in initially, but not having to wait for the different diagnostic tools or steps was very, very lucky.
So, as a scientist, do you approach your diagnosis differently than someone without a scientific background?
Yeah, I think that during like my undergrad degree and my master's degrees and even in the PhD, I took a lot of classes where we did things like molecular biology and genetics, and I even have a class for cancer biology. So I knew enough of like the terms and the way the doctors would speak about cancer to kind of, I think, have a pretty good understanding of what was going on, understand a lot of the mechanisms behind how the treatments work and everything, and how things are diagnosed and graded and everything. So I think that helped me kind of compartmentalize it and think of it more scientifically than this is what's actually happening to me. But it also let me know I know very little compared to my doctors, right? So um, I think it gave me enough knowledge to not be so scared about it, but also to know that, like, okay, it's in their hands. Trust your doctors.
Yeah, that's totally true.
Hmm.
If we go back a little bit, you mentioned that you were diagnosed with a HER2 positive breast
Hmm.
cancer. Will you explain to the audience that may not too sure maybe what that means and what?
Yeah, so usually when you get diagnosed, they are looking for at least three different markers: the HER2, progesterone receptor, and estrogen receptor. And so HER2 is another kind of receptor as well. All three of these receptors, they are sitting on the cell surface, and they are going to sense different hormones, usually a growth hormone or estrogen or progesterone. And that's going to signal to the cell to grow and divide. And that's kind of one of the ways in which your cancer can kind of grow and divide exponentially, and increases the risk of metastatic cancer or going elsewhere in the body. And so HER2 is one of these receptors that recognizes a growth factor and then gets told it's time to grow and divide, and that's not what we want. But it also it used to be that HER2 positive breast cancer was kind of the worst to get because they didn't have a lot of really good treatments. But now, because of how great science has really exploded in this area, now we have drugs that really target the HER2 receptor itself. And instead of it being something that's good for the cancer, now it's something that we can target and we can prevent it from being able to do its job. And also, it sends a little signal. We have these drugs now that can immunotherapy that will recognize the HER2 receptor and then tell the rest of your immune system, hey, this is a bad cell, kill this cell. And so now it's probably one of the best cancers that you can get for breast cancer because the treatments are so good for HER2 positive.
Okay. What are the moments when understanding biology help you cope or perhaps made the experience more complex?
When it's made it more complex.
Actually help you coping or make it more complex just because you
Yeah,
understanding
I
a
think
mechanism.
when I got diagnosed, I met with my oncologist for the first time, and she was explaining all of the different drugs and how they worked. That was another moment in which I could compartmentalize what was happening to me and just kind of nerd out on the science. And that really helps you kind of cope when you can kind of turn off part of your brain that's afraid and turn on the part of your brain that's like, oh, that's so cool, and that's going to happen inside my body. So that I think that was really cool. And she was walking me through, especially how the immunotherapy works to target the Herceptin positive cells, or sorry, not Herceptin, HER2 positive cells with the drug called Herceptin. And so that was really cool.
Okay. Were you curious about how treatments like chemotherapy, radiation, or immunotherapy work at the biological level as well?
Yeah, so when I got diagnosed and we got the list of drugs and everything, I definitely did a lot of Googling and looking at different papers that describe how these things were discovered, or the how the drugs work, and these kind of things. So that was an interesting little road for me to go down. Um, Sorry, what was there more to the question?
No, that's okay, no worries.
Okay.
So is that so you were curious about these treatments, and then
Yes.
when you find out what these treatments, like let's
Uh-huh.
maybe yes, unload the question a little bit. So
Uh-huh.
we go back into your chemotherapy. So you
Uh-huh.
have chemotherapy before surgery. That's what
Right.
we call neoadjuvant chemo. And some of the medications that they've been given to patients with HER2 positive,
Hmm.
ERPR positive is the Taxols, which is
Hmm.
very toxic and can
Hmm.
create something called neuropathy, and,
Yes.
and then they do the Herceptin. So if we go back into some of these medications, do you have any side effects from them at all during
Oh,
the
yeah, of course. Yeah. So for my neoadjuvant therapy, so before surgery, I had a cocktail that was Taxol, carboplatin, Herceptin, and Perjeta. And so the Taxol and the carboplatin, those are the real chemo drugs that are targeting rapidly dividing cells. So those are the drugs that make you lose your hair, lose your eyebrows, lose your eyelashes. And give you all of the GI symptoms that are really unpleasant to deal with. And then the Herceptin and the Perjeta, those are the immunotherapy drugs that target the HER2 positive cells. Um, and those can also come with their own side effects. So during chemo, I think the obvious biggest side effect was just losing my hair, but we have so many really great drugs that help mitigate all of the different side effects. So I was really scared of chemo at first, thinking that I was going to have just a terrible time, that I was going to be throwing up all the time, that I was going to be in pain, that I was going to be sleeping all the time. But that really didn't manifest. Um, they give you a lot of steroids and anti-nausea medicines and these kind of things. And so the day of chemo, I would get home and I would clean like a mad woman. And then the next day I would be up and awake and really, really active. And then probably about day 3 or 4 afterwards, that's when I would have kind of like my crashing period where my energy levels were really low. But then the next day I would be totally fine again, bouncing back and everything. I had a really great drug called olanzapine, which I think is normally prescribed as like an antipsychotic drug.
Mhm.
However, it works really well for anti-nausea for cancer patients as well. And it was my favorite drug because I never got nauseous at all on chemo. I never had any vomiting issues or anything like that. Um, so for me, like the side effects that I was most worried about never ended up happening. I obviously was worried about losing my hair and everything, but I knew there was really no getting around that one. So
How
um,
how did you do with the fatigue?
with the
Any
fatigue, with the fatigue I had Durley. So she had me on the chemo protocol for physical therapy, and every not every on the morning of my chemo, I would wake up a little bit earlier, and my husband and I would go on our little run walk. And so I'd walk for about 5 minutes and then getting my heart rate up, and then I would run for about 45 seconds to a minute until my heart rate got up to 155, I think is what we were targeting for. And then I would walk for about 30 seconds until it got back down. And then I would run. And then I would walk. And then I would run. And I did that for about 30 minutes. And then I would head off to chemo. Um, And then every day I was trying to walk for at least like 15 to 30 minutes. And we had our other exercises that Durley gave me to just try to keep you moving and that keep that fatigue from setting in. And for the most part, I feel like it worked really well. Like I said, on that day four, that day I would usually crash down pretty hard. Those were the hardest days, but it was usually just really, really tired and sleepy. And then by the next day, I was able to get up and move and be normal
And
again.
what you mean is, we know that the best way to fight cancer-related fatigue is strength training,
Hmm.
cardiovascular training. So for strength training, we do a lot of different compound movements, and it is. I mean, she many times came all the way from Jacksonville and just really worked hard for 45 minutes, and we got her heart rate where she needed to be in a combination of strength training and cardio.
Hmm.
And part of the reason why we do that is because has been a lot of research out there supporting that exercise prior to chemotherapy can enhance the chemotherapy effects
Hmm.
and definitely can help to mitigate some of those side effects, like the fatigue, the nausea, try to avoid for you guys to lose a lot of skeletal muscle mass and becoming
Hmm.
weaker. So that has been a really nice ball game changer as well. That
Yeah.
how, like what you say when you were diagnosed and you thought about chemotherapy, you thought, oh my God, I won't be able to work. I'll be all day in bed. I won't be
Mhm.
able to do anything because it's a lot of what the perception is.
Yes,
But we
absolutely.
know that that's not true at all, and we want you to be completely opposite from that. And
Hmm.
that day three or four, which we call it another day, that's the day that we tell patients try to take it easy. I mean, take it
Hmm.
easy doesn't mean be in a bed, but
Yeah.
limit your chores. You don't necessarily want to do heavy training that day. If you feel
Right.
like, do a slight walk, but that's the day that a lot of your red counts, blood counts go down.
Right. Right. Right.
They came back for bouncing back. So, but yeah, you did really, really great on that. And I think that you did really well throughout chemo in
Yeah.
general. And then
Yeah.
recovered fast out of surgery. Yep.
I really tolerated the chemo very, very well. Um, it to me on it, if you told me you have to either do radiation or chemo again, I'm gonna do chemo before I do radiation again.
I mean, how, it's hard. And then we're thinking usually, oh no, if you survive chemo, radiation is going to be so easy.
Oh yeah.
Because we're thinking, chemotherapy is more general systemic.
Hmm.
Surgery versus radiation is very localized, but
Yes.
some patients really react not that great to the radiation. So
Yes.
jump into the radiation. Now we
Yeah.
talk about chemotherapy as a treatment. Tell us your experience going through radiation.
So what for radiation, I had it 5 days a week for 25 days. So I only got Saturday and Sunday off. But however, I also had it over, I think, Christmas and New Year's and Martin Luther King. So on these holidays, I would have those days off as well, which was sometimes very nice. But it was very tiring to have to go every single day. And then you sit there and you're in this position, getting the radiation. And it's just like, imagine going to the beach and getting a sunburn and then going back tomorrow and getting another sunburn and going back the next day and getting another and on and on and on. And it's all in the same spot, right? So it's um, like getting a sunburn in the exact same spot day after day after day. And I think around the 10th treatment, so my cancer was on this side, and we had some in the lymph nodes, so they were really targeting this armpit area. And by about the 10th treatment, I would say moving my arm like this even was almost impossible because it was so red and was getting blistery. And so Durley had given me a lot of exercises to try to keep my mobility. But by that 10th day, it was too painful to
Uncomfortable.
really do these kind of motions. Um, but luckily, my doctor, Dr. T.T. Biswas, she gave me some really great creams and stuff, and once we got those going, it kind of cleared up a lot better, and I was able. It was still very painful, very annoying, but it was definitely more tolerable throughout the rest of treatment. And I would have to say the fatigue from it too was really different than the fatigue that you get from chemo, because the fatigue from chemo is is intense for one day and then it was gone. And then, but for radiation, it was just kind of always there and not super intense. Just like if I stop moving, I don't want to start moving again.
Mm,
Right. So instead of just taking, one easy day, it was having to struggle through it every single day to
mm.
not let yourself get down into that low energy.
Okay. And then with your immunotherapy, again,
Mhm.
done many reactions with it?
No, immunotherapy's not been too bad. So the sh it's a shot that I get. It's kind of weird. It goes into the thigh, and they have to administer the shot over a period of 5 minutes. So the needle is just sitting in my thigh for 5 minutes, and the nurse is just like slowly plunging down on the needle. Um, and that's every 21 days. So I actually have immunotherapy tomorrow. Um, and the side effects from that are usually just GI symptoms. So very unpleasant GI symptoms. And that's really it. I have no fatigue related to the immunotherapy. The other side effect from that, particularly Herceptin, is it's known to be associated with some heart problems. And so I have to have an echocardiogram every 3 months to make sure that my heart is still healthy and functioning. And as far as I know, everything has been going well with that. My doctor hasn't pulled the drug, told me we needed to take a break or anything. So, and I don't feel like like I'm having any heart issues or anything while I've been on it. So that's been nice, but it is like another thing that I have to do every 3 months. I have to have an echocardiogram to make sure everything's going good there. But those are really the only side effects from the immunotherapy.
Yeah. And again, one more time, right? She continued working on her routine of
Oh,
exercise
yes.
because we know that was the best way to keep that heart healthier,
Yes.
is really keeping up with that routine of exercise.
Yes.
So did your colleagues or your scientific community provide good support during your cancer journey?
Oh yeah, absolutely. My boss is kind of funny because I work for it's a dual PI lab. So there's two of them and they are married. And I work directly under Jose Lemos. He's the man. And when I told him that I have cancer, I told him, and I was rambling on for a minute, and then he just stops and looks at me and he says, "You're gonna have to start over because I lost track after you said I have cancer." And then when I talked to his wife about it later, she says, "Did Jose tell you about Lisa?" And I was like, No, who's Lisa?" And she said, "Oh, Jose's best friend's wife is Dr. Lisa Spiegel, who is the head of breast cancer surgery here at UF.
Oh my God, I
Do
didn't
you,
know
do you
that.
want us to get in touch with her for you?"
Oh
And
my God.
so he just completely blanked all of these things.
Oh
But
my
they
God, that's
they
so
were able to get me in touch with Dr. Spiegel, who was my surgeon, and uh, she treated me amazing. So it's been really great, and they really helped me kind of figure out how to keep doing science while I was going through all of my different treatments. So when I was going through chemo, I wasn't able to go into the lab for most of the days, particularly because they were afraid I was immunocompromised, and we work with pretty deadly bacteria. So but I was able to do a lot of things from home, working on different writing projects. And I'm sure, you've probably heard of all of these different things like AlphaFold that have kind of exploded in the news and pop culture and pop science. Um, so I was able to do a lot of in silico stuff from the computer and kind of keep up that way. And then after surgery, I was able to come back in full time. I came to work every day during radiation, and they were very supportive of making sure, if you get tired, you can go home. And
Mhm.
um, they got me an office where I could be by myself so that it was nice and quiet for me, or if people were sick and I needed to seclude myself. So that was really great. And all of my lab mates have all been amazing in helping me through everything. A very supportive group.
That's excellent. That's very,
Yeah.
That's really helpful. One thing I
Yeah.
encourage patients a lot to do is to try to keep a normal life as possible.
Hmm.
I think sometimes when we get hit with a diagnosis like this, you quit everything, then
Hmm.
it's not the greatest for your mental health because then you're just so focused on every little detail that happened versus when you are working,
Hmm.
your mind goes into work. And then if you feel maybe a little nausea or you don't feel that great, you just forget about it because you know you have a project that you need to work
Hmm.
on and you need to just try to keep up
Hmm.
necessarily, or if you're a mom, or if you do whatever you do, or if you practice a sport, as long as safe and in a safe environment, like in your case,
Hmm.
you're able to give you an office by yourself to protect
Hmm.
you a little bit because your immune system, I think is the best thing to do because you just want to try to at least have something normal. You want to have to be able to take control of your life
Yeah.
because you feel all of a sudden that you have no
That
control
loss.
or you lost all the
Yeah.
decision making and you just go doctor to doctor to doctor and everybody tell you what to do and you're like, oh, okay, okay, what do I go next and where do I go next? So
Hmm.
it's nice to have that ownership to no, I am still being who I am and I'm still be able to do whatever I'm doing every day. I think
Hmm.
it's so helpful. How did you going through how did you going through breast cancer change your perspective on science, medicine, or healthcare?
So, obviously I always had a high opinion of science. Otherwise, I wouldn't be doing what I've didn't been doing. But it also really showed me how impactful this, whoop, sorry, I just dropped my pen. How impactful the science that we do can really be to people's lives. Like I said, that I was terrified of all the potential side effects of chemo, but because, people have done all of these great studies to help mitigate these side effects, I didn't find chemo to be all that bad, to be honest, and the drugs that they use are so amazing that when I had my surgery, they send out some of the tissue to make sure, that the cancer is all gone, and there was no detectable cancer left by the time I had surgery. And so that just tells you that this mass that at the time of diagnosis had pretty much taken up all of the breast tissue and had gone into my lymph nodes was gone, was completely gone, right? So these drugs really, really work. So I already had a high opinion, then I had a higher opinion.
That's awesome.
Um,
And
yeah,
again, we wish every patient respond as well as you did because you have an amazing
yeah,
response. And in the beginning, even discussing your case with Dr. Spiegel is like
uh-huh.
you were thinking, okay, more likely she's going to have an axillary dissection, and more
Hmm.
likely she's going to have an LV bypass, and no, none of that
Yep.
because you have such a great response to chemo. So that's great. Has this journey influenced the kinds of research questions that you're interested in now?
You know, a little bit, but not really too much. I am a microbiologist, so bacteria is my first love. And I think that I would never really want to study cancer because I'm too close to it. It's a little too close, and I think it would keep me up at night a little bit too much. But it has made me think a lot about the gut microbiome because, as I've said, some of the most severe side effects that I actually had were GI issues. And so I do wonder, how do these drugs impact the microbiome, and can we kind of design better therapies to protect or give you
That's great.
I don't know if you've heard of FNT, but it's a fecal oral transplant of healthy gut microbes into a cancer patient that's experiencing these things. Can we mitigate the side effects, these GI side effects, these kind of things? They've definitely creeped up into my mind, but I don't think it's changed my career trajectory because, like I said, it might be a little too close for my comfort.
But I love that you actually start thinking about because now, as we know,
Mhm.
a lot of the microbiome create a lot of issues.
Oh,
Sometimes
yes.
you're
Hmm.
wondering why somebody who is healthy, young, end up with breast cancer.
Hmm.
And sometimes is as well a lot of our systems, right? Is these inflammatory processes that happen in the body, is what we put in the mouth, is the inactivity, all the chemistry that we get exposed to every day from
Hmm.
plastics to processed foods to all these things that you surround by day by day.
Hmm.
So how much of if we start changing some of that, including a microbiome,
Hmm.
and make and be healthier, we can try to really prevent a lot of chronic disease, being cancer one of them. So I
Hmm.
think it's a great thing that is kind of put it in the back of your head a little
Yeah.
bit. Um, do you feel your experience has made you more passionate about communicating science or supporting cancer research?
Hmm. Well, that's hard to say too. It's hard to communicate science. Um, And I wish I was better at it. I think that's one thing, especially to the community, to the public, right? Like that's a really important tool. And people who have these talents, I am a little bit jealous of them. But for me, it's always hard to not get bogged down in the terminology and to explain it at a better level, I guess. Uh, yeah, yeah, I think definitely better for, cancer awareness and most of the people I work with are almost all women. We are a gigantic lab of women. And so when I got diagnosis, I told them all just because you're young does not mean that this can't happen.
Yeah.
So make sure you are vigilant in getting your screenings and these kind of things.
Mhm.
And I definitely you'll see marathons for breast cancer or different colon cancer or any kind of cancer. And I always want to support, even if I can't run uh, for myself, Um, yeah, it's hard to say if it's more now than it was before, because cancer has been a part of my life previously from, grandparents and aunts and uncles and stuff that have had cancer before. So I think I've always kind of been aware of it, and but getting it yourself is obviously very, very different. Yeah.
Okay. So, has this journey taught you about resilience and the connection between science and humanity?
Yeah, definitely about resilience. The organism that I work on, Enterococcus faecalis, it is known to be a very hardy pathogen. So we call it the ultimate survivor. Like if you think of the old TV show Survivor,
Wow.
like it is the ultimate survivor. And so I kind of, when I got diagnosed, thought to myself, you have to be like Enterococcus. You have to survive.
That's a good way. And this is
Yeah, you have to be the ultimate
only
survivor.
microbiologists has
Yes.
kind of confer that.
Yes. Sorry, I'm thinking about the second part of your question. So, sorry, can you repeat the second part of the question?
Yeah. And the connection between science and humanity.
Oh, yes, absolutely. So, when you go into science, sometimes you get bogged down in these little nitty-gritty details of your experiments and everything, and you forget about what the big picture is. And so I do think that getting diagnosed and going through this entire journey with the treatments and the side effects and mitigating the side effects and going to PT and all of these things has reminded me that what we do is not to answer this tiny little question about how does Enterococcus obtain iron from the environment, but how can that better people's lives? How can that improve human health? And so to just remember the big picture here is to improve human health and humanity in general. And so that it's definitely a good reminder for me.
Yeah. And sometimes that kind of brings us down to, again, what can we do to improve that, right? How can we make some people better, right?
Hmm.
How can we expand education? And that's part of why I do what I do with this
Hmm.
platform. How can we just, you guys can share your journey and be able
Hmm.
to help others that are just start that process now, and how we can just kind of try to make everyone's life a little bit easier going through
Hmm.
anything like this. So appreciate that.
Yeah.
What message of hope would you like to leave to listeners today?
Um, Message of hope. You can do it. It's only a year. Get through it and then get back to life.
Uh-huh. Awesome. I
Yeah.
love that. I love that. So, Debra, thank you so
Mhm.
much. That has been such a fun conversation. I really appreciate it. And I'm sure the audience will be really inspired by you. I really appreciate it.
Thank you.
All right. You have a great evening.
You too. Bye.
Bye.